Hi, my name is Sonia. I'm a registered nurse who spent the majority of my career specializing in diabetes with a focus on diabetic eye disease. I'm here today to tell you about the importance of having a yearly eye exam when you're diabetic. Diabetes is a disease that causes a problem within our bodies of regulating sugar. When our bodies don't regulate sugar properly, it can cause an increase in the amount of sugar inside of our blood vessels. This increase in blood sugar can cause damage to the lining of our blood vessel. I like to compare it to cavities. Having too much candy can cause sugar to stick to the enamel of the teeth, and this sugar can cause cavities. In the same way, having high sugar inside of our blood vessels can cause sugar molecules to stick to the lining of our blood vessels, causing cavities or damage to the blood vessels. And the eye is not immune to this damage. Having high blood sugars can cause damage to the blood vessels in the eyes. When this occurs, we call it diabetic eye disease. And according to Diabetes Canada, diabetic eye disease is the leading cause of blindness among working age adults. When people first start to develop diabetic eye disease, they generally don't have any problems with their vision. That is why it's so important to have a yearly eye exam. It gives the healthcare professional the ability to see into the back of the eye, assess for any damage, and treat it as needed. And for individuals themselves, it gives them the knowledge that there is damage happening, which in turn gives them motivation to make a change. I remember seeing a man in his 40s. He was a mechanic and he used his vision to work on aircrafts. After screening, he was told that there was some mild damage to the inside of his eyes, and that if he did not get his blood sugars under control, he may lose his sight in the future. He spent the next year eating right, taking his medications, and exercising. And when he came back to see me in a year, I was shocked. His blood sugars had improved dramatically, so much so that his blood sugars were reading in a normal level. And he had significantly reduced his risk of developing blindness from diabetic eye disease. When I asked him what had changed, he said that the thought of losing his vision was too much for him, and he had to do anything within his power to make it change. So you see, even though diabetic eye screening is not a treatment for diabetic eye disease, it gives healthcare professionals the ability to assess and treat early. And it gives individuals the knowledge that there is damage occurring and that it's time to make a change. So if you're diabetic or you know anyone who's diabetic, having a yearly eye exam is the first step in saving your sight. Thank you.